Hello, welcome to my channel. I am going to do a 6-week update today on my dental implant procedure that I had done on October 19th, 2021. I had that done in Charlotte, North Carolina with Dr. Christian Yaste. I had 24 extractions that day. They were able to place 10 implants and my lower arch with the temporaries. Unfortunately, I did have a lot of complications with the uppers. They described it as paper mache. So every time that they were trying to place the implant, it was they were like just poking through. So I had to have a lot of grafting done on the uppers, as well as I had a hole in the sinus cavity that needed to be fixed. So I woke up from surgery that day with a denture on the upper. Was it disappointing? Very disappointing, but it's okay. I'm glad that my dentist did not try and push the issue, and he did what was right. So I'm doing great though. So 6 weeks, how am I doing? I'm doing good. Every day gets a little bit better. 2 days ago, I lost the rest of the stitches on the upper. So all of my stitches are out on the upper. On the lower, I do still have some underneath of that arch. Of course, I can barely see them, but I know that they're there. This past week, I started using the water pick, and it's amazing the stuff that comes out from that lower arch underneath of it. So I started using that, so that's going well. It is a learning curve, I'm not gonna lie. I mean, I've never used a water pick before, and let me tell you something, that stuff sprays everywhere, and I've just made huge messes in my bathroom. But I'm getting the hang of it. What am I eating? Trying to eat more foods, more variety. Still, of course, on the soft food diet, but doing things like, I did some ground beef, like hamburger, and sorry for the vegetarians, but I minced that up just as small as I possibly could, and I was able to eat that. I can chew a little bit. It's not great. I can't really break down the food a lot when I'm chewing, but I'm trying and it's getting better. So I just have been telling my husband that I'm hungry. The macaroni and cheese and yogurt and all the soft stuff is getting very tiresome. So my body is craving like some more solids. So hopefully soon that will come. I do have a follow-up appointment on December 17th, and we're going to discuss at that time if I'm ready to get my temporary upper arch placed. So I'm excited about that. I'm not going to lie, I'm extremely nervous. I've had a lot of anxiety since he told me about the process. It will be about a 3 to 3.5 hour appointment. He will have to open up my gums on the uppers again, and place, so he can place the screws in to place the upper arch. He will just deaden me, and that, give me shots in the mouth. And for some reason, I don't know why, I'm having a lot of anxiety about that procedure. I'm scared, and after everything I've been through, years and years and years of dental work, pain, suffering, I don't know why I'm so apprehensive about it and feeling so anxious about it. I know I'm like scared of the pain, and I'm scared of the feeling that that's going to be with the upper in. Maybe somebody has been through that before and had some similar feelings. I don't know. Why am I afraid to get shots? I went through this huge operation. Like, if I can do that, I can do anything. But for some reason, I just have a lot of anxiety when it comes to that procedure. So I'll just be happy when it's over. I don't want to keep thinking about it anymore. I just want it to be done. And then we will look forward to then in 6 months getting my permanents placed. But things are looking good. Everything feels pretty good. My speech is so much better. If you've looked at my earlier videos, you will see that I was having a really difficult time talking. I still have issues, but it's just so much better. And as the day goes on, I get more fatigued. Then my speech gets a little bit worse, but I think I'm doing really good for 6 weeks. I'm excited to see what the future holds. The inside is still a little swollen, still swollen inside my nose. I can see it here on my face is still swollen. If you didn't know that I had anything done, you wouldn't notice that, but I do notice it. One other thing that I notice is that my lip, and I know you can see it on the video because that's where I notice it. I have one area where my upper lip is sagging, and I don't know if it's just maybe a nerve got hit, so it's causing that. But I will discuss that with my doctor as well, because that's a little worrisome, a little bothersome to me. I don't like to see that on the video when I look at it, when I replay it. That is a little bothersome. So I will discuss that with him when I go in next time. So that's it. That's the update. If you have any questions, please let me know. Put them down below. If you want to give me a thumbs up, that would be great. Subscribe if you enjoy this content. Every week I think I get one more subscriber. I guess I'll just keep chipping away at it. I'm doing this just as much for me as I am for you. I want to make this record so that I can go back and look in on it and remember what happened and how I was at this point and what the process was. And we have a tendency to forget the small details, so I want to keep that fresh in my mind. So I have this to do that. I'm going to try and do some things to get some more attention to my channel. I've tried to comment on other channels' videos and let people know that I also am making videos. So if you have any questions or anything, let me know. I think I have a little bit to offer as far as that goes. I just did go through this $45,000 procedure that I paid cash. I'm so thankful that I was able to do that. It was a huge step for me, and it was a big investment in my future. So let me know if you have any questions about that. I'll give you a final quick look at my teeth. One of these days, maybe I'll take out the denture before I get my uppers placed. I know that a lot of people say they won't take them out on camera. I really don't mind doing that. It doesn't really bother me in context of the video itself, so maybe next time I'll do that. Sorry if my shirt is a bit of a distraction today. It is, Christmas, so I put the Christmas Mickey shirt on. I'm working from home. You can hear my emails popping on there. But I'll leave you at this point, and I hope you have a great day, and you come back again soon. And I dropped my remote control, so I got to get that. All right, guys, have a great day.